Go ahead, sir.
Uh, so the slide is not coming in the screen. Can I unable to project the slide, please? Yeah. Well, a very good afternoon to all of you. So, it's a part of our monthly Facebook Live program. So today I am going to highlight on adolescent PCOS. So all of you must have heard about the term PCOS very often. That is polycystic ovarian syndrome. But today I will speak on a special entity of PCOS that is known as adolescent PCOS. So the term adolescent, as you know, these are the people who are just beyond their puberty and but usually around below the age of 19 years, so you can say that these are just post pubertal girls but who have not crossed their 20s, so those are the young girls or young women. So there is a special entity which they are affected by polycystic ovarian syndrome, so we call it is adolescent PCOS. So definitely it is not the same as that of the adult PCOS. So the terminology adolescent PCOS. Well, when we speak about PCOS or polycystic ovarian syndrome, people think that she is an obese, a bearded lady who is having cysts in her ovaries. So the name polycystic, that means there are cysts in her ovary. So do you think it is the condition all the time? But if you'll ask that how many of you will agree that PCOS is not simply a disease of the ovary, though we coin the disease as polycystic ovary, but it is not always confined to ovary, and especially in cases of adolescent polycystic ovarian syndrome. So how it is? Then let us speak. So if we'll see how polycystic ovarian syndrome is beyond ovarian cells, then you can see that the manifestations of polycystic ovarian syndrome starts with reproductive. I mean, it affects the reproductive system of the females, that it causes infertility, or even after the pregnancy, it leads to a lot of complications like preeclampsia and all. And it has a broad range of manifestations in the skin, the dermatological manifestations like hirsutism, acne, and alopecia and all. And so also it causes a lot of anxiety, depression. So it affects the psychology, and it has a very broad spectrum metabolic defect in the body like obesity, metabolic syndrome, insulin resistance, diabetes, and all. And so also it affects the sleep. It causes a lot of sleep disturbances, even insomnia and all. So it is not simply a disease of the ovary, rather it affects so many systems of the body. So it is worth knowing about the disease. If I ask that how many of you will be agree if it is told that polycystic ovarian syndrome is not limited to the reproductive age group only. That means I was speaking about the age group beyond that of the 20 years and all. But if you'll see that it can also affect before the reproductive age group or puberty, and it can also affect ladies after menopause. So it has also known as a disease which starts from womb and continues up to term. That means it has its origin in the fetal life. That means it has some environmental or genetic impact in the fetus for which it develops later. And mostly it manifests at and around puberty and adolescence. And it has clinical symptoms that affects during the reproductive years. And in the long run, it continues to be there in the peri and post-menopausal women. Well, then the diagnosis of polycystic ovarian syndrome, all of us or many of you must be knowing that there is a criteria called Rotterdam criteria, where usually we take three things. That is ultrasound parameters. Means in ultrasound we see there are cysts in the ovary. Next we take if she is having hyperandrogenic features like androgen levels in her blood is increased, or features of hyperandrogenemia like there will be pimples, baldness, alopecia and all, and there can be irregular menses or which is also known as anovulation. These three, any two of these three criteria present, that is called polycystic ovarian syndrome as per Rotterdam criteria. But There are some guidelines like international PCOS guideline, which has recommended that if you are diagnosing a case of polycystic ovarian syndrome in adolescent age group, then the ultrasound criteria is not required. That means we need not do the ultrasound at all, because many of the young girls up to the age of 19 or 20, the ovaries are highly polycystic by normally, means by naturally it is polycystic. So just by looking at the number of follicles more than 20, volume is more than 10 cc of the ovary, we cannot just diagnose them as polycystic ovarian syndrome. Rather, that is normal for them. So exclude that ultrasound criteria. So ultrasound is not required for them. Rather, we should see whether their blood is having high level of androgens or features of hyperandrogenemia in their skin, hair, means alopecia, the acne, and all are present. And if there is also oligoovulation or anovulation in the form of irregular menstruation, if these two things are there, then they should be considered as adolescent PCOS. So why then, when we are considering hyperandrogenism like acne and wellness, it is then you must have seen that most of the young girls, adolescent girls, are having pimples in their faces. That is a normal phenomenon of that age group. So just by looking at few pimples on the face, we should not tell them that she is polycystic. Rather, if the pimples are severe or very much acne is severe, and the hirsutism, the hair growth and everything, there is terminal hair of more than 5 millimeter, and a lot of hairs are present with a scoring, FG scoring of more than 4 or 6. Such kind of girls should be considered as hirsutism or hyperandrogenic. Not the simple few pimples are not considered as hyperandrogenism. So, but biochemical hyperandrogenemia, if you can find out the levels, the androgen levels in the blood, then that also gives as a very better criteria. And irregular menses, again in the girls, it is not same as that of the adults. Usually, you know that the normal intermenstrual cycle up to 21 to 35 days, 28 plus minus 7 days is considered normal for adults. But for adolescents, means a intermenstrual cycle up to 45 days. If she is within 3 years of her menarche, then up to 45 days also normal. Or if continuously she is having more than 90, up to 90 days of amenorrhea in one time in a year, complete year, then also it is normal for that adolescent age group. And if she is having primary amenorrhea by the age 15 or more than 3 years followed by breast development, still she is continuing to have amenorrhea even after 3 years, then only we should consider them as means irregular menses, or else it is normal for them. So it is not the same as that of the adults. The irregular menses can be very much irregular, not simply just irregular for adolescents, and so also the androgenism, hyperandrogenism. Anyway, so then why we are talking about adolescent means PCOS as separate entity, because the diagnosis is not the same as that of the adults. Then where the problem lies, whether it is in the diagnosis or in the treatment. Of course, it can be a dual-edged sword. You can say both diagnosis and treatment. Sometimes we overdiagnose, sometimes we overtreatment. So that's why I wish to tell that all pimples or little bit of hirsutism should not be considered, and so also a little bit of irregular menses should not be considered. So that we should not subject those young girls into type of medications or treatment. So how should we approach to treatment for an adolescent PCOS patient? Then first of all, that we should take a comprehensive history. Usually when any such girls comes to us, we take whether there any family history of polycystic ovarian syndrome or diabetes or any other kinds of hormonal disorders, and so whether she is having any other medical disorders like thyroid problems, prolactin problems, and all, and any other symptoms specifically. So a comprehensive history means we take the detailed history, and after that we go proceed for examination. Just like we take her height, weight, we calculate the BMI, and so also we take the full body assessment to find out the features of hirsutism. We find out acne, alopecia, the circumference, acanthosis nigricans, blood pressure, thyroid status. So many other things also we look for. And so far as the acne and hirsutism is concerned, usually we ask to have the this scoring, that is FG scoring, that is Perryman-Gallwey scoring and Ludwig scoring. There are some medical scoring systems are there which we use, and if the score is more than 4 for that white people or more than 6 for Asians like us, then only we consider them as hirsute. Otherwise, we should not consider it. Then once we diagnose them from a complete history, physical assessment, and all this scoring and all, then we proceed for the management. The management, the first line in the management of adolescent PCOS is lifestyle interventions. It is the first line because lifestyle is something which alters the metabolic and the hormonal means imbalance in the body. Thereby leads to the cure of the condition or relief of the condition. So the lifestyle interventions are in the form of behavioral strategies, in the form of dietary interventions, in the form of exercise, and so also obesity and weight management, because that is very very important, because some of the girls who are obese, or at least they should not gain weight. So that should be our motto. So and if you'll see, there are so many evidences, a lot of publications which tell that, even that of the Endocrine Society, that which recommends that implementing lifestyle intervention is primary first approach for adolescent PCOS, followed by oral contraceptive pill as a second line agent. So always the treatment for adolescent PCOS, the first line is never the medications like the hormonal pills. Always we emphasize, or rather we should emphasize on lifestyle intervention. It is the work means recommendation by authentic bodies like Endocrine Society. And so also, if you see the lifestyle intervention I told, that should be in the form of diet or in the form of exercise. So if you'll see the diet, actually there is no one dietary type is recommended for polycystic ovarian syndrome. Rather, we should give more emphasis on calorie restriction, more important than composition. The energy deficit should be 30% or 500 to 750 kilocalories per day for weight loss, and at least 1200 to 1500 kilocalories per day could be prescribed for them if required. So dietary consumption should be limited, and exercise should be taken as a method for to reduce the weight gain. And to reduce the weight gain for those normal weight people or adolescent girls, they should perform at least 60 minutes of moderate to vigorous intensity physical activity per day, and including those that strengthen their muscle and bone at least 3 times daily. They should do this, and at least 10-minute bouts or around 1,000 steps if they want to walk or have a brisk walking. Then 1,000 steps in a day, aiming to achieve at least 30 minutes in a day. Walking or this much of exercise, 60 minutes they should do to prevent weight gain. And similarly, those who are already obese and to lose their weight, they should have a little bit of more exercise, in the form that they should perform at least 250 minutes of exercise per week of moderate intensity exercise. If they are going for a vigorous intensity exercise, then it should be 150 minutes per week. And if they are going for muscle strengthening activities involving major muscle groups on 2 non-consecutive days per week, they should also perform. And minimize sedentary screen or sitting time. They should not continue to sit or watch the television or mobile and all. So sedentary activities should be minimized, and daily 10,000 steps to lose weight. At least 10,000 steps ideal daily, including activities of daily living, and 30 minutes of structured physical activity, or 3,000 steps of upward steps of stairs this they can climb. So this is the ways how they can lose weight. And because both ways, they should prevent gaining weight, they should lose weight if at all their obese or BMI is high. And there are also evidences which tell that weight loss in obese patients with hyperandrogenemia with polycystic ovarian syndrome has been shown to decrease androgen levels, increase the sex hormone binding globulin, and reduce clinical hirsutism. So this is a condition which leads to so many kinds of benefits in them. So definitely, this evidence tells that encouraging exercise and good diet is very very beneficial. And so far as the management of these adolescent PCOS is concerned, as I told, that achievable goals such as weight loss up to 5 to 10% in 6 months, it leads to so many benefits like improved menstrual cyclicity and resumption of ovulation, decreases hirsutism and acne, decreases the risk of future comorbidities, ameliorates the psychological problems, improve the metabolic disorders. So it has so many advantages. And but at the same time, we should not be biased by some of the myths that women with PCOS cannot lose weight. and dietary advice and exercise is only for overweight or obese PCOS. Well, so far as the adolescent PCOS is concerned, it has a risk of developing future PCOS because adolescent PCOS is an entity which is diagnosed during the adolescent period. But if they are not cured and they continue to have the symptoms and they develop symptoms of adolescent PCOS, then we should target or focus on those girls. And so also there are some at-risk PCOS, means they have some symptoms which is not exactly matching to adolescent PCOS, but which may in future they can also be converted into PCOS. So those are the girls we should give special emphasis, and because reassessment is particularly important for adolescent girls with the persisting PCOS features and those with significant weight gain during this time. So a lot of evidence tells that we should give emphasis on such people also. Well, so we are treating them with diet and exercise, a good amount of lifestyle management, but still the symptoms are either aggravating or still continuing. Then what next? What should we do? Whether we should continue the same treatment or anything new or anything extra we have to add. Well, to know that, I must tell you about the American College of Obstetrics and Gynecologists committee opinion or recommendation. Here they prescribe that we should always have a multimodal approach. Multimodal approach means it is not only a single type of treatment is required for them, rather lifestyle changes is the first line treatment always there. Along with that, we should continue to have some oral contraception. I told low dose pills usually we use oral contraceptive pills, and because that causes cycle regulation, so also it decreases the androgen levels. And after that, if she has excessive hair growth, then it can be hair can be removed. Or features of hyperandrogenism, or the blood contains high levels of androgen, hyperandrogenemia, and we can use medications or drugs which will lead to androgen suppression. And remember, before initiation of any medical therapy, expectations of treatment should be discussed with the patient, because one point that we have to keep in mind and we have to tell our patient that PCOS is something that is not going to be cured. It will be there lifelong with them. So once we have started the treatment or we are giving a pharmacotherapy, it has a short-term benefit. The duration will provide the treatment, it will have some benefit. And once we stop it, she may have again those symptoms back. So all those counseling expectations should be kept in mind so that they will not be biased. Well, all said and done, that our discussion will be incomplete if we will not talk about recent advances. So at one point of time, I told you what is adolescent PCOS and how it is different from that of the adult PCOS, and what is the main modality of treatment in the form of lifestyle, followed by medications if required. But the recent advances, anything new in the science? Yes, the science is always gives miracles or gives surprises. Nowadays, there are a lot of research going on about microbiota. That means they have some, especially the gut microbiota, the microorganisms that are growing as commensals inside our intestine. They have some role in the development of polycystic ovary syndrome and even its metabolic disorders. The study has demonstrated that women with PCOS had lower biodiversity in gut microbiota, of which are closely associated with insulin resistance and abnormal lipid metabolism. That means this gut microbiota may vary from person to person. Then whether it is influenced by the environment, influenced by the diet or anything else. Yes, obviously the gut microbiota is influenced by diet. So the kind of diet we are consuming, if you are taking more of natural and fiber-based diet, mostly fiber-based, starch-based diet acts as prebiotic. This prebiotic helps in growing of the probiotics, means these are the microorganisms which produces some kind of whatever you can say the byproducts which helps in reducing the PCOS. But if you are consuming some foods which is not natural for our gut, like junk food, unhealthy food and all, so the prebiotic is not getting enough to support to the probiotics or the microorganisms, so that these metabolic parameters are getting disturbed. Hence, the gut microbiome may influence the development and pathology of PCOS and its metabolic disorders as well. Well, friends, so once we have understood what is adolescent PCOS and how to treat it and what is recent advance, let us have some take-home message at the end. One point I must say that We should not overdiagnose or overtreat the adolescent PCOS. Already I mentioned why. And because ultrasound is again not mandatory in diagnosis of adolescent PCOS, but we use it for adult PCOS. And also lifestyle interventions are the mainstay of treatment. This is the first line treatment. And role of prebiotic and probiotic in diet as it affects the gut microbiota, which can prevent PCOS, seems to be an icebreaker in this treatment, and the lifestyle strategy of its treatment also. Hence, adolescent PCOS is such a condition that let's catch those PCOS patients still when they are young. But as I told, that there is high chance that these people will develop PCOS in future, and leading to a lot of means, complications or affecting their multiple body systems. So if you are catching them or diagnosing them still while they are young, with simple treatment of lifestyle management, we may treat it, we may cure it, but that is the way how we can prevent the adverse or long-term side effects of polycystic ovarian syndrome. Thank you. Hope with this discussion we have a broad idea and clear message regarding what is adolescent PCOS and how it is different from that of the adult PCOS. Thank you very much for watching us Facebook Live. And now I must expect some questions or any doubts if you have. Please put into the message box so that I'll be happy to answer them. Thank you. Yes, there is a specific question that what are the first signs of PCOS in teenagers? So teenagers means mostly we believe that these are the adolescent people below 19 or 20 years. So as I told, it is not like that of the typical adult PCOS, but initially they may have features of hyperandrogenism or irregular menstruation, but as I told that even the irregular menstruation are very normal for them, but unless the cycle intercycle interval is more than 45 days or very less than 21 days, or it is not there for more than 3 months in a single stretch in a year, entire year, we should not consider them as PCOS. So many of the girls come with irregular menses, but typical irregular menses would be there, and so also we get some hyperandrogenic features. But hyperandrogenism again, as I told, that simple having some pimples, a little bit of hair growth is not hyperandrogenism. It should fulfill the criteria. So before diagnosing PCOS in teenagers, we should be very careful. It should not be overdiagnosed so that we can prevent overtreatment. Thank you. PCOS can start. I told you there is a slide called Om to Tom. So PCOS can start from the fetal life itself. So but symptoms are not prominent, but the symptoms can start from puberty. As soon as she gets her pubertal changes or menarche, menstruation and all, from that time it can start it, and then it continues as a adolescent PCOS. But many ladies they develop PCOS in their adult life in 20s, mostly in 20s. So it can start at any age, but symptoms starts from puberty, if at all. Thank you. PCOS is such a condition that never goes away. If it gets suppressed, the symptoms get suppressed. It gets the hormones may get balanced, but because it is something which may have multimodal origin, genetics, and environment, and all. So usually it is not get cured completely, but the signs and symptoms do suppress or improve, but does not go away completely 100%. Yes. While talking about food in PCOS, as I told, not as very specific kind of diet therapy is advised, but always we discourage to take junk foods, you can say preserved foods, you can say fast foods, more of oily stuffs or more of sugary stuffs, because these are the foods which not only give more of calories to the body for weight gain, more of oil or cholesterol into the circulation, and so also it disturbs the gut microbiota. So all over it disturbs, it aggravates the symptoms of PCOS. So it should be avoided. Yes. Thank you. Is PCOS genetic? Yes, as I told that PCOS is something that has a multi-modal origin or multi means origin is not a single reason is there. So it has some genetic predisposition, but you cannot tell exactly familial or a single gene is responsible for it. Multiple genes has been identified, but may not be 100% responsible. But yes, it has some genetic role, and it is influenced by environment, by the lifestyle, by our food habits and all. So it has multiple reasons of origin. Yes, thank you. Thank you for watching Facebook Live by Oasis Fertility. So I think we can end the